Hello, and thank you for joining us this evening for a discussion on how educators and school staff can take steps to take care of their mental health and well-being during the summer months. My name is Alyssa Dubé. I am the Director of Clinical Services at the Scanlon Center for School Mental Health and a Clinical Associate Professor of Counseling Psychology. I earned my PhD in Counseling Psychology from the University of Iowa in 2010 after completing my predoctoral internship at Oregon Health and Science University in Portland, Oregon. I'm currently a licensed psychologist and health service provider. I have the privilege of introducing my co-presenters this evening. We'll start with Sam McVansel. Dr. Sam McVansel is a senior behavioral health clinician at the Scanlon Center for School Mental Health. Sam has a long history of working in and with schools. She was previously a math teacher in Arizona, and most recently she was employed as a school psychologist at Grantwood AEA, where she worked since 2017. Sam is a graduate of the University of Iowa doctoral program in school psychology. Next, we have Arthi Kular. Dr. Arthi Kular is a licensed clinical psychologist and the director of provider network services and product integration at Protocol Services. Arthi worked in university mental health prior to co-founding the Shrink Space, now WellTrack Connect. Arthi continues to manage the product strategy and growth of WellTrack Connect, as well as the product integration of the WellTrack platform of behavioral health solutions. And we have Mary Lynn Kiefer. Mary Lynn Kiefer is a passionate mental health advocate and senior manager of partnerships at Togetherall, an online peer support community moderated 24/7 by licensed clinicians. She was most recently the executive director of the Maid of Millions Foundation in Canada, a mental health nonprofit organization. She is also an active member in the mental health community in Toronto and has completed a peer support training program. So I'm going to turn it over to Sam, who will kick us off.
Well, welcome. We're going to talk about how to care for your mental health during the summer. To sort of start off, we want to kind of frame what's going on and why are we talking about mental health in the summer for school staff. So school staff are some of the hardest working people I've ever met, and there's a lot of stressors facing them throughout the school year, and especially the last few years since we've had school closures due to the pandemic. They've been asked to support the mental health needs of students, which have increased in the last few years. There's been a lot of staffing shortages, both with teacher shortages as well as other school staff and substitute teacher shortages. So teachers are being asked to cover classes, which they lose prep time, and then they're having to do work outside of hours, which creates longer working hours and more stress. There's also increased instructional needs for students. So with school closures and then the varying rules about quarantining and all sorts of things, kids have missed a lot of instructional time, and that's varied from kid to kid, depending on their circumstances. And so there's been this, increased pressure to fill those gaps, get kids caught up, and do it for every student in your class. And then all of that amounts to teachers working longer hours, and longer hours just means everybody's more tired and more stressed out. And so there's just a lot of things, a lot of different pressures on teachers. And so what we're seeing is that in a recent study, which surveyed school staff members, that school staff are reporting higher rates of frequent job-related stress, burnout, symptoms of depression, and not coping well with job-related stress. And this is compared to just working adults in other professions. Another interesting sort of statistic was that adults working in other professions reported higher rates of resiliency than school staff did. And so we know that school staff members are feeling the effects of these stressors, and they're feeling burnt out, and they're feeling stressed in their jobs, and they're experiencing symptoms of depression at higher rates. And so it's a tough time to be in education, and we want to talk about a few things that you can do this summer to prioritize your mental health and take care of your mental health. So I like to think about summer for school staff members as kind of like the new year for everyone else. New Year's resolutions, the new year comes, we make resolutions, and often we make lots of resolutions and set really lofty goals for ourselves. And then by the third week in January, most of us have kind of given up on those. And I think summer feels that way for school staff sometimes, because you have this, 6 to 8 week period where you are not working in school, you have time off, and you want to get all of these things done. So setting goals for projects and taking vacations and finally training for that 5K that you've always wanted to run and all of these things. And then we often get to July or August and we've maybe done a few of things on our list, and it's frustrating. We feel disappointed. And so I think I first want to preface this with set goals that are reasonable and attainable. Maybe set one or two that you really want to work on, and let the rest be for next summer or the summer after that. But some things you can do related to your mental health, or things you can try and find time for this summer, are finding ways to connect. We know social connection can have a positive impact on mental health and well-being. So whether that's catching up with an old friend, or making dinner plans with people, or having regular play dates with other parents, or however it is you want to connect, finding ways to connect can be a great way to recharge. Prioritizing some of those general self-care needs. With all of the working long hours and all of the stress, sleep sometimes is the first thing that gets lost. I don't know, when I was working in schools, I can't tell you how many times I missed lunch. So doing things like eating through, regular meals throughout the day, and then movement, moving however feels good for you and however you enjoy moving are some great things to try and do over the summer. Doing things you enjoy, so activities you enjoy can reduce your stress and improve your mood. Pick one thing and do it if you want, or pick up that old hobby that you haven't tried in a while. Whatever, find an activity you enjoy and take a little time to do it if that's how you want to spend some time this summer. And then the last thing is consider working with a therapist. So a lot of the things I've touched on are what we call self-care self-care areas, and working with a therapist or a therapy group can support you with your self-care goals. And so finally, when thinking about taking care of your mental health this summer, like I said, set self-care goals that are attainable and reasonable. Figure out what works for you. Caring for your mental health doesn't have to look any particular way. If it works for you to the time you have is in the evening after your kids go to bed to do these things, great. If it's once a week, great. Whatever it is and however it's going to work for you, that's great. And then think about what support you may need, whether it's from friends to help, hold you accountable, to thinking about working with a therapist, to asking grandparents to come and hang out with your kids so you can do this thing you enjoy. Whatever it is, think about what support you may need in meeting your self-care goals. And so with that, I'm going to turn it back over to Alyssa to talk about some of the clinical services we offer at the Scanlon Center.
Okay, thanks, Sam, for those tips, and for taking the time to really think about setting those goals in a way that are attainable and not other things to become frustrated about. I think that's so important, and looking at, if my goal is to write, journal every day, not necessarily having to journal 5 pages every night, but maybe, giving myself a minute or two, or meditation for a couple of minutes. So I think those are really helpful tips. So I appreciate you sharing those. What I would like to chat about as a little bit would be the clinical services that we do have available through the Scanlon Center for School Mental Health that are for educators and school staff. So this is a little snippet of our clinical services flyer, and it talks about the services that we offer throughout the whole year, both to students and to educators and school staff. For the purpose of this chat today, I'm going to focus in on staff, but we do offer short-term psychotherapy, so counseling or therapy services for educators. And that is available to educators across the whole state of Iowa. And in the next slides, I'll talk a little bit more about what that might look like for you, as well as if you're interested, how would you do that? So the model that we've set up is a brief therapy model. Because we serve the whole state, we also have to be mindful of not taking on too much at one time. And we want to make sure that if we are working with clients, that we also have the opportunity to open up appointments to other clients who might be waiting as well. So brief therapy, we've found in our first year of operation that this has actually been a really good amount of time for working with folks on who have really set goals for what they want to accomplish in counseling related to their mental health and well-being. So we will start off by talking about what are your goals? What are you wanting to get out of this? What might be reasonable in those 10 sessions? And for some people, that will be exactly what they need. And for others, a few sessions in, we might be thinking about, do we want to look at longer term options as well? So we're getting started here, having a really good place to get going on some of this work, and then looking at what are the next steps for you. We also are serving people over telehealth. So that is the way that we're able to serve people across the state of Iowa. Since we can't be in every part of the state, we're over here in Eastern Iowa and Iowa City, but we can provide telehealth. The important thing to know, as some of you might be having vacations and so on, we are licensed in Iowa, which means that the client, you would have to be in the state of Iowa for those sessions, just to make sure we're following all those rules and laws. And at present, we have funding from the state to cover the cost of these services. So there is no cost to you as an educator, as a school staff member in the state of Iowa for taking part in these services. So who is eligible? When we're looking at the educator school staff side of this, it's all pre-K through 12 educators and school staff. So that includes, the teachers, the administrators, counselors, support staff, any of those folks that are employed by the school. It's also both public and private schools, if there are questions about that. We also want to make sure that this is an appropriate experience for folks based on the goals that they have and the needs that they have. So somebody would have to be an appropriate fit for short-term therapy and also for telehealth services. And that's something that we can kind of talk through if somebody's interested. We have an initial consultation as the first step. So we would meet with you and talk through that to make sure that this feels like a good fit for you. And really our goal is to increase access to care for educators and school staff across the state of Iowa, particularly given some of the findings that Sam presented about the needs of educators and how important it is that we're supporting all of you as you're working to support our children. At the bottom of this slide, I talk a little bit about the areas we're really targeting, knowing Iowa is a rural state. And so there are service deserts. There are areas where it's really hard to find any providers. And so we are trying to prioritize working with folks who are from those rural areas to give them access to care. Also, individuals who are facing barriers. This has come up quite a bit for the students that we're serving. So people who might have financial barriers or transportation barriers, but we've also seen it with some of the educators that we're working with where it's just hard for them to access the other services. And then the last one, which I think is pretty relevant to educators, would be bridge services. And this is to support those folks who know they want some mental health support. They've been on wait lists. Wait lists can be long in this state because of the few providers who are out there. And perhaps there's an immediate need that we can help with. So you can start therapy with us, do 10 sessions as you're waiting to get in with a longer term provider. So accessing services is pretty simple. We have our email address here for our clinic. That's the first step. You just send an email and say, I'd like to work with a counselor. Once we receive that, we would respond with an electronic form. So we get some more information about you, including your contact information and sort of what you're looking for. Then you, as I mentioned earlier, we would set up a telehealth meeting. That would be an initial consultation with one of our clinicians. And that would be to talk through what your concerns are, what you're hoping to get from counseling, what we're able to provide, seeing if it's the right fit. If it is, then we'll go ahead and complete the consent forms. If it doesn't seem like a good fit and you're looking to work with another provider, we also can provide some support. And Arthi's going to talk more about that process and the way that we are helping connect people with other providers. And then once we've gone through the consent forms, then we go ahead and just get you set up with your counselor. So in addition to individual counseling, we also have an educator resiliency group that will be starting very soon. We were able to pilot this a couple of times in the last school year and had really good feedback. So we have a couple of our clinicians will be offering this, and I have details on the next slide about when and where. But this will be a skills group focused on building resiliency and coping skills based on Marsha Linehan's dialectic behavior therapy, focusing on self-resilience. And it will be an 8-week group offered virtually through telehealth. Again, participation is voluntary. There's no cost. You will have to sign a consent form in order to participate, which is done electronically. And some of the skills that will be focused on are mindfulness skills, distress tolerance, emotion regulation, and interpersonal effectiveness. So on the next slide, again, eligibility is open to all the pre-K through 12 school staff. In Iowa, we have our start date set for June 15th, so it's coming up in 1 month. It will be on Thursdays from 10 to 11 a.m., lasting 8 weeks. And we will open registration May 18th. So that's just in a couple of days. There is a cap of 15. So we're going to be kind of first come, first serve for that, where we'll take the first 15 folks for that service. If you have any questions about that, also the email address, the SCSMH-clinic is a good place to send those questions. So I'm about ready to turn this over because there are 2 other services that we have been able to offer through partnerships that Mary Lynn will talk about. Together All Educator Community, and we also have WellTrack Connect, which Arthi will be talking about. So with that, I am going to turn it over, and I think we're running a little ahead, so you all have a few extra minutes.
Okay, I think I'm up next, so I'm going to share my screen here. Okay, so I wanted to show you what the Together All platform looks like. So it is a peer support platform that's available to all of you for free. And I wanted to also share a little bit about my own experience with peer support. So I was diagnosed with OCD in 2017, and it was kind of a eye-opening experience because I didn't know that what I was dealing with had a name. And so when I got diagnosed, there was relief, of course, but then it was like, okay, what do I do now? And so of course, therapy was something that really helped me, a very specialized type of OCD therapy called exposure response prevention therapy. And then also a lot of education, so things like mindfulness as well. But I just found like it wasn't enough. And I really was looking for a resource that was going to be available, between therapy sessions when I was at home and just kind of having a tough time. And so a friend actually recommended joining a peer support group. And at first I thought, the idea of talking to strangers was like really quite scary. And so I was really reluctant at first, but at that point I was, like I said, just really almost desperate to find other resources. And so I did join a peer support group. I'm in Toronto, so I might have a bit of an odd accent to some of you in the US. And I walked in and I was very nervous, and I sat down, and I would say within 5 minutes, I just hearing from other people that also had, specifically in this case, OCD, it was like, wow, I'm not the only one with this thought process that was experiencing this. And so it was just this validation, this feeling of empowerment that there were other people that got through this. I can say that right now, for the last few years, I've had very minimal symptoms. So it's something that I manage quite well, but it is something, peer support is something that I continue to access. And I do that, on a volunteer basis here in the Toronto community for the OCD community. And so I'm really excited to show you how Together All works and what it looks like. And so, of course, the peer support group that I went to, it was in person. This is an online community. So what's exciting about that is you can access it at any point, whether it's from your desktop, from your phone. And as you can see, it really is, it looks like just like another Facebook or one of these other social platforms that we're all familiar with. So it's very easy to use. And as you can see, it's, people, you can either share, posts, or also if you're looking to talk about anything in particular, you can filter that. But I did want to mention one of the unique features about Together All is it is monitored and moderated 24/7 by clinicians. So that's a really unique feature. So behind the scenes, there's clinicians that are kind of just making sure that it's a safe space at all times. And so if there are any situations where there are any comments where the clinician feels that they need to, intervene, then they will directly get in touch with that individual. But this is me coming into the community as a returning member. I will also show you how you all can access this, but just want to show you the platform first. So as you can see in the top right-hand corner here, hopefully you can see, I don't know how big it is there, but I have my anonymous username as Bougainvillea2. So this is how I will show up on the platform at all times. And so I think being anonymous is something that really kind of helps with that, any sort of fear of any stigma surrounding the idea of coming into a community and talking with a bunch of strangers. So at any point I post anything, that's the name that will show up. And then at the bottom here, although I don't know if you can see it because on my side there's a live microphone, but hopefully you don't see it there. But at the bottom right-hand corner here, it says Ask a Wall Guide. And so a wall guide is our nickname for a clinician. So there's a little message bubble here. So at any point you can directly reach out to a clinician, which I think, from the standpoint of having that direct access to a clinician, if you need to get in touch with them, that's really great. And then I'll show you how to kind of filter it. So obviously, depending on what you're going through, you can really filter it to anything. I mean, mental health is a spectrum. I myself was diagnosed with an actual condition, but we deal with stressors all the time. And so it could be anything just from having relationship troubles or, extra stress at work, dealing with burnout, having a child that might be dealing with anxiety. And so there's all these things that we go through every single day. And sometimes, and we hear a lot from our community, that oftentimes it's easier to open up to strangers online to talk about this type of thing. There's less judgment. And so this platform really allows people to do that. So if you go into categories, you can decide, if you want to read any comments specifically about depression, you can click on that. If there's a lot of stress, you can click on that. And then at that point, any of the comments in the community that focus on that will pop up. You can really use this as a way just to kind of read through comments, or you can get involved and actively engage and create your own post by just clicking on this here. So again, I just want to reiterate that it doesn't necessarily have to be for a mental health condition. There are a variety of stressors, and Together All has been around for the last 15 years. And so we have millions of people have access to Together All, and we have about 10,000 individuals that engage on the platform monthly. So it's a very robust and vibrant community, and people are on there, like I said, 24/7, and it is a global community. So you'll have folks from other parts of the world as well. Another thing I wanted to share is we do have specific groups. So like some people might want to come on and just speak in general about what they might be going through, but as an educator, you might want to talk to other educators about specific things that you might be going through at school. And so we do have a group, we have multiple groups, but the one I wanted to highlight here was for the educators. So there is this group here that you can join. And so you just have to agree and then join the group. And then you'd be able to go in and again, specifically chat about, whatever it was that was specifically bothering you about what was going on in that profession. So I just quickly wanted to show you how to actually register. So you'll see here, I have included a QR code. So if you put, if you want to just grab the QR code there, you can do so, but we will also drop the direct link into the chat as well. And I showed you the screen of, when I was a returning user, but if you are accessing that link, all you have to do is go directly to the link, and then there's a few prompts that you'll want to go through just to get registered, and then you go right in. So it's, it takes just a matter of minutes. And then quickly, I just wanted to show you, there are other resources available. So there's courses available. It sounds like, there's already a lot of other resources available that Alyssa mentioned, but there are also courses if, quitting smoking is something that you're looking at doing, managing anger. And so there are a variety of courses as well, if that's more so how you would like to use the platform. And then we have other resources. So this, I'm, looking at the view of a Scanlon member. So this is how you all will see it. And so there will be other external resources that will be available to you, and perhaps something that we can update even more as, Scanlon provides more and more resources. So having said that, I wanted to point out WellTrack Connect. So this is, one of the resources that is available to you. And I wanted to pass it over to Arthi to take us through WellTrack Connect. And I'm happy to answer any questions at the end about the platform further. So thank you.
Wonderful. Thank you, Mary Lynn. And Sam and Alyssa for this background. Really excited to talk to everyone today and just share another resource available to yourself as well as your staff, as well as your students. And so I'll first start by just talking about how you all can access WellTrack Connect. And so WellTrack Connect is a platform of over 12,000 behavioral health clinicians, including therapists, counselors, prescribers, so nurse practitioners, psychiatrists, dietitians, and nutritionists that specialize in eating disorders, as well as higher level treatment facilities like intensive outpatient programs and inpatient facilities. And so the Scanlon Center is really committed to bringing resources to the state. And so we're really excited to partner with you all and provide easier access, broader access to a diverse range of clinicians so that you can access longer term care, specialized care, whatever it may be to fit your needs. And so oftentimes, as Sam was mentioning, school year can be really busy, and the summer can be a good time even to just start treatment, to kind of start the process such that when the school year begins or restarts in the fall, you have invested in the time to get to know a clinician, find a clinician, and then can use the school year as ongoing work, but not feel like you're, having to consult with a number of clinicians while also managing what is a very stressful job for educators these days. And so I wanted to just give you a sense of how to sign up on the platform as well as how to utilize it, because it is a bit of a different type of referral platform or database, if you will, that's really specialized to Iowa educators and your students. So let me just start by sharing my screen. Let's see if I can figure this out. Okay. And so here on the homepage, what you're going to see is a unique URL for educators, Iowa educators, And the URL will pop into the comments so that you have it. But it is scsmh.org.welltrackconnect. And so what you're going to see when you're on the homepage is the ability to either log in or sign up. And I'm going to just quickly walk through the sign up phase so you can see what it looks like. You would be considered a community member. And so you just click community member, pop in your name, email address. And then one thing that's really important as you're signing up is to make sure that you select yes, that you are part of a community organization partnered with us. And the reason for this is we want you to make sure that you identify as part of the Scanlon Center for School Mental Health, because part of the partnership is that you'll actually have additional features available to you when you identify as part of the Scanlon Center. So please do make sure to do that. We are not tracking any of your data, and so we don't know your name, anything like that. But what is important is that you have full access to the platform. You enter a password and then just agree to our privacy and terms of service. And so I'm going to sign in right now. I'm not going to go through this whole confirmation process, but I will sign in right now just so you can see what it looks like when you're signed in. And highlight some features that are unique to our platform for the Scanlon Center. And so when you are logged in, you're going to see the ability to do a search, which I'll do in just a bit. But you'll also see the ability for if you're, say, signed in and want to show this to your students, you can always redirect and click here, and it'll bring you to the homepage for what your students would see. And so whether it's your student or a parent of your students, they can access very similar site, but the URL is a little different, and we'll be sure to also pop that into the chat. So I'm going to hop back onto the original site for you all. And then a couple other things I want to point out is you will have an explainer video to give you a little bit more background of what we do and who we are. So feel free to take a look at that video. And then lastly, in the footer, you're going to see this quick link to a list of over 700 clinicians that are licensed to practice in Iowa. And this is a list that's been curated by the Scanlon Center. And I want to start here because this list basically is a short list of providers that have either created profiles or are known to the Scanlon Center, and the Scanlon Center has created a profile on their behalf. So it's a really nice place to have a comprehensive list of clinicians that are licensed in Iowa for you to search based on what your unique needs are, whether by specialty, location, type of treatment, whatever it may be. And so you can sort through this list, search this list. And one of the things I want to point out is when you are on this list looking through it, I'm going to go to a provider's profile. And let's go to Ricky's profile. And when you're looking at Ricky's profile or any provider's profile, there are a couple of things I want to highlight. You'll of course be able to see, where they're located, if they're accepting new clients, but you'll also be able to read more about them. You'll be able to read a little bit more about how they incorporate diversity, equity, inclusion into their clinical work. You'll see their specialties, how they orient, anything that has a dotted line. If you hover over, you'll see a brief description of what that is. You'll see insurance is accepted as well as out-of-pocket fees. So of course, this fee range may be very less if you're using any in-network insurance plan. And then one of the other unique features that Scanlon Center educators and students have access to is the ability to actually check your insurance. And this is a cool feature where you can get kind of a brief overview of what your insurance looks like. And if you were to click on this, it's just going to ask you for some basic information about what your insurance is, your member ID and date of birth, and then you can click eligibility. And this information, again, will give you a snapshot as to what, the copay may look like, any remaining amounts on your in-network or out-of-network deductible. But one thing to keep in mind is you always want to make sure that you are confirming your insurance eligibility with the provider as well as your insurance company to just make sure that the provider is actually indeed in network with that plan. Other things you're going to see is what their availability is. And then you'll have the ability to either message or call the provider. If you send them a message, you just pop in your phone number and any specific information you want to share with the provider. This will then send a secure email to that provider, and then the provider can get back to you either via email or phone number. And so all messages on our platform are encrypted for your own privacy, which is something important to keep in mind. The next thing I want to just show you is that in the case that, Alyssa was mentioning, if you were to come to the Scanlon Center and have come in for a couple of sessions and then want to continue in long-term treatment, the Scanlon Center may actually create a custom referral list of a couple of providers that are known to them that they think may be a good fit for you. And if you were to get that custom referral list, it will get emailed to you, and then you can also use that list as kind of a starting point to access different referrals. So that's a nice way that the clinic is connected to WellTrack Connect as well. And then the last thing to keep in mind of how you can use it is if, in the case that you're not in the state of Iowa for the summer and you're in any state in the US for that matter, but say like you're in Wisconsin or in Minneapolis or Minnesota for the summer, you could also search the database for clinicians that are licensed to practice there as well. So let's do a search for, like, if you're in Milwaukee in Wisconsin for the summer and wanted to do a search for providers more local that are licensed in Milwaukee, you could also use the database to search for providers there. And so you can then apply any number of any number of filters, including accepting new clients and the payment types accepting for. You can search by specialty, provider identity, their availability, in-network insurance if you want to use your insurance, as well as a number of additional other features or filters, So this is a nice resource as well if you're wanting to look beyond the list of clinicians that are already known to the Scanlon Center. If those folks are not fitting your unique needs, you can also broaden your search to search the list of over 12,000 providers. And then the last thing I wanted to do was just show you a list of resources that the Scanlon Center has generated for all educators. And the way that you can access that list of resources, if you go to your avatar, which is this person icon at the top of right-hand screen, and click Student Resources, this actually I'm going to update that to read Member Resources, so apologies there. But you're going to see a list of resources that may be adjunctive to any clinical services that you may be looking for. And so this is a list also curated by the Scanlon Center, and you can feel free to look through this. Here you're also going to see a link to connect back to TogetherAll, which again, you have access to. And so if you were to click this, it'll just take you directly to the ability to create an account on TogetherAll's site. And so if you ever lose that link, you can, of course, access it here. And feel free to peruse through this list of resources. And the last thing before I turn it back over to Alyssa, just to keep in mind, is that there are, I imagine, many situations in which your students may be benefiting from additional clinical services. And one thing to keep in mind is that all of your students have access to WellTrack Connect. They do have a different URL. And so if you're talking to any of your students or parents of students, you can always direct them and encourage them to go to scsmh.k12.welltrackconnect.com. And they too can look for providers that best fit their needs as well. So that may be a helpful resource for your students as needed. And so with that, I will turn it back over to Alyssa.
I have to unmute. Thank you so much, Sam and Arthi and Mary Lynn, for sharing these resources. I'm actually going to share my screen for just a moment. I haven't practiced this because I wasn't planning on doing it. I don't know what's going to share, but I'm going to try to show our website because you can also access all of this information for WellTrack Connect and TogetherAll on the website.
And just as you're doing that, Alyssa, I was just going to mention for Together All, it is only available to the educators. So just wanted to point that out there because there is an age limit of 16 plus. And so at this point, it's only available to educators. So just wanted to highlight that.
Thank you. Yeah, that's a good point. It's for adults. So this is our website. If you just Google Scanlon Center, you'll find it under the Clinical Services tab for our clinic. And across the top, we have the tab for Together All, which will take you right to the sign up for Together All. Like that. It'll take you right there. I'm going to jump back. It actually gives you more information about Together All first. And then to access WellTrack Connect, you click Find a Therapist, and it'll take you right to a landing page for that. And I had mentioned earlier that we have a group. So if you scroll down for our services, there's information about our short-term individual counseling, our group counseling. So we have other groups, and these are about to be updated to give you more information about those. So you can watch that to see when these groups will be offered in the future. I think that's everything we were hoping to cover today. So I hope you all found this to be beneficial. I don't know how to stop sharing. Maybe I already did. Thank you for joining us this evening. It was great sharing this information with you. If you have other questions, please do contact our clinic at the email we provided, scsmh-clinic@uiowa.edu. Thank you.